Okay. So, arbovirus. Definition of arboviruses. What is an arbovirus? So, arbovirus, from the word arbovirus, as you can see, arbo, so it comes from the word arthropod-borne virus. So, ARBO. So, arthropod-borne viruses. Okay, that's the acronym. So arboviruses are maintained in nature through biological transmission between susceptible vertebrate hosts by blood-feeding arthropods. Vertebrate infection occurs when the infected arthropod takes a blood meal. So can you give me examples of arthropods in the chart? Any arthropod you know? Examples of arthropods? Mosquito, yes. So, ticks, yes. Any other? There's so many arthropods. Sandflies, yes. Spiders, scorpions, yes, all those. Oh, so you know the arthropods. So vertebrate infection occurs when the infected arthropod takes a blood meal. So these are the main families. We have Togaviridae, Flaviviridae or Flavivirus, Bunyaviridae or Bunyavirus, and Rioviridae. Okay, so we're going to look at all these viruses. So we'll start off with the arthropod vectors. We have mosquitoes, ticks, sandflies. So mosquitoes, we have different types of mosquitoes that give off different types of viruses. So we have Japanese encephalitis, dengue fever, yellow fever, Rift Valley fever, St. Louis encephalitis. And then we also have, we also have EEE, WEE, VEE. So we are going to see Eastern, so this is Eastern equine encephalitis, Western equine encephalitis, then VEE. Then we have ticks, Crimean Congo hemorrhagic fever, Kayasanur forest disease, various tick-borne encephalitis. Then for sandflies, we have Sicilian sandfly fever. Okay, so you have to know this. They can ask you, all the following viruses are spread by a mosquito except, then they just put a tick-borne virus. Okay, so you have to remember this. We'll go through them. So diseases caused by arboviruses, we have fever and rash. These are the three main ones: fever and rash, encephalitis, and hemorrhagic fever. Fever and rash, this is usually a non-specific illness resembling a number of other virus illnesses such as influenza, rubella, and enterovirus infection. The patients may go on to develop encephalitis or hemorrhagic fever. Okay, and you see here, blood is oozing from the orifice. So here it came out from the nose. Encephalitis, Eastern equine encephalitis, Western equine encephalitis, St. Louis encephalitis, Japanese encephalitis. Then hemorrhagic fever, yellow fever, dengue, Crimean Congo, hemorrhagic fever. We're going to see. But look at this. Can you see this? Eastern equine encephalitis, family from Togavirus. The genus is alphavirus. Reservoir is birds, transmitted by mosquitoes. Then host is a dead or ended or an end host. So animals are incidental hosts. So as you can see, here's the transmission cycle. Starts from the reservoir. Here's where the virus is. Then the vector bites the bird. Then the bird. So vector is the one that transmits the virus. So as the mosquito is biting the bird, then it went, bites. So this mosquito can also incidentally go bite humans or bite horses. So equine comes from the word horse. So it can bite the host, which is the dead or end host, and then incidentally it can bite humans. Children more likely to have severe clinical symptoms than adults because they are more immunocompromised. The symptoms, incubation period is 4 to 10 days. Eastern equine encephalitis can result in febrile illness, so this is fever, or a neurological disease. So neurological disease due to the encephalitis, we have meningitis. So meningitis is inflammation of the meninges, or encephalitis, inflammation of the brain parenchyma. The type of illness will depend on the age of the person and other factors. Some people who become infected with Eastern equine encephalitis virus may be asymptomatic. Okay, so if you're immunocompromised, if you're a child, most likely you're going to get these symptoms. You start a fever, then viremia goes to blood, spreads to the brain or the meninges. Febrile illness is characterized by fever, chills, body aches, and joint pain. The illness lasts 1 to 2 weeks, and most people recover completely when there is no central nervous system involvement. So before the virus affects the CNS, so that you get meningitis or encephalitis, you'd have recovered. Then for neurological disease, we have fever, headache, vomiting, diarrhea, seizures, behavioral changes, which are like mood changes. So seizures are convulsions, drowsiness, and coma. Okay. So these are features, we call them features of increased intracranial pressure. In infants, neurologic disease often occurs soon after onset. In older children and adults, encephalitis may occur after several days of systemic illness. So, as we had explained earlier, infants and younger children, they're more immunocompromised. Approximately a third of people with encephalitis due to Eastern equine encephalitis die. Death usually occurs 2 to 10 days after onset of symptoms, but can occur much later. Many people who recover are left with long-term physical or mental impairments, which can range from mild brain dysfunction to severe intellectual impairment. So, which makes sense since the virus is going and it's spreading to the meninges, it affects the brain. So you have intellectual impairment, personality disorders, seizures, paralysis, and cranial nerve dysfunction. So the reason is we know that cranial nerves, they originate from the brain stem, so the midbrain pons and cerebellum. Midbrain pons and cerebellum. So, the cranial nerves arise from the midbrain and the pons. No, is it the cerebellum? Sorry, I've confused myself. So, if the disease has gone and affected where the cranial nerves arise, you'll have cranial nerve dysfunction. So if it's cranial nerve 1, you'll have a problem with smelling. If it's cranial nerve 2, you'll have a problem with your vision, and there, so on and so forth. Then people with severe impairments often require long-term care and die within few years. Okay. Higher. Diagnosis. So for diagnosis, EEE based on the patient's clinical symptoms, and lab diagnosis by testing blood and CSF. Okay. which will show if the virus or antibodies against the virus are present in the person. Sorry, I want to correct myself. I said cerebellum. I meant medulla. So it's midbrain, pons, and medulla. Okay? Yeah, sorry, I was confused. So for treatment, there's no vaccine or specific antiviral treatments for EEE that are available. So if you see there is no vaccine or any antivirals, we do symptomatology treatment. So we treat the symptoms, over-the-counter pain relievers to reduce the fever and the joint pain. In severe cases, patients would need to be hospitalized to receive supportive treatment, such as fluids, pain medication, and nursing care. Okay. So we are done with Toga virus. So the main one that you should know is the Eastern equine encephalitis. So Venezuelan and Western, quite similar. Now we are done with this. We're now going to Flaviviridae. Okay. Flaviviridae, it's a family of positive single-stranded enveloped RNA viruses. They are found in arthropods, primarily ticks and mosquitoes, and occasionally infect humans. Remember, we said these are the vectors. They can be spread from humans. It can affect humans and it can affect animals. Examples, we have dengue, yellow fever, West Nile, and Japanese encephalitis. We start with dengue. So I've had people call it dengue. So some people call it dengue. So just remember the spelling is DENGUE. So there are 4 different dengue virus serotypes. We have DN1, DN2, DN3, DN4. Main hosts, non-human primates. So these are the apes, the monkeys, the gorillas, orangutan. So 2.5 billion individuals are at risk of infection with dengue fever virus. 40 to 80 million infected each year with thousands of deaths. As you can see here, look at where dengue fever, the countries in yellow are the ones that dengue fever has been reported. So what can you guys comment about this? The countries that are at risk of getting dengue. What can you see from this map that you can comment? Mostly countries in the southern hemisphere. Yeah, so that's a good observation. And areas around the equator. Yes, along the equator. So that's the main observation I wanted you guys to see. The equator passes around here. It was to draw an imaginary line somewhere here. So you can see areas around here. So that is where those mosquitoes will be found. The mosquitoes that cause dengue fever. Okay, so these areas are too cold for them. These ones down here. These areas, they're too cold for the mosquitoes. Clinical manifestation. So febrile illness associated with headache, bone, muscle, joint pain, rash, and leukopenia. So leukopenia means low leukocytes in blood, or the WBCs in blood. Then we have dengue hemorrhagic fever, characterized by 4 symptoms: high fever, hemorrhagic phenomenon, and signs of circulatory failure. Such patients may develop dengue shock syndrome. Okay. So this one you have to know the 4 symptoms. Number 1, high fever, hemorrhagic phenomenon, and signs of circulatory failure. Okay. So you have to know that. So What do you mean by signs of circulatory failure? So this is someone who is, they are having circulatory overload. So what happens is, basically in dengue, what happens is there is a reaction that occurs when there is viremia. You'll have the fever. So fever is due to your body trying to fight off those viruses. So fever is the response by your body. And then, but now the fever is usually very severe. Okay. And then the hemorrhagic phenomenon is, I think I had mentioned it earlier. So you'll have the purpura. Remember purpura, as Wycliffe had helped us to define it, the microvascular hemorrhage between yours, beneath your skin. You'll have purpura, you'll have ecchymosis, you'll have hematemesis. So hematemesis is you vomit blood. You'll have melena. Melena is when you have a bleed, usually on the upper GI, like a bleed maybe in the stomach. And then when you pass your stool, it's usually dark in color. Okay. So what is happening is, this is because you have something we call it thrombocytopenia. So thrombocytopenia is low platelets in blood. So, and we know the function of platelets in blood is to cause clotting. So when you have these platelets that are insufficient, so you cannot clot blood. You cannot clot that blood. So in case you bleed, what happens is you overbleed. That's why you have these presentations. And then circulatory failure. So this is when you've had organ failure. So your liver will fail, your spleen will fail, your heart will fail, and then you'll have circulatory failure. So circulatory failure is when you now have fluid that builds up in your body. So if your heart has failed, your kidney has failed, what happens is you have fluid that accumulates in your body. So it will manifest as something we call ascites. So ascites is when you have a lot of fluid around your abdominal region. You can have pleural effusion. Pleural effusion is when you have fluid. So pleura is the space between your lungs. So there's that pleura. So you see that pleura, there'll be fluid there. Okay. So when you have pleural effusion, you'll now start getting signs of respiratory failure because you can't breathe properly. And then such patients may develop dengue shock syndrome. So dengue shock syndrome is when you have all these symptoms, as we had said, and then you now develop shock. Okay. So in shock, since your blood is, remember you're losing blood since you have thrombocytopenia, and now not enough blood can go to your tissues. So you're in a state of, we call it hypoxia. Hypoxia is when there's not enough oxygen going to the tissues. Okay. And when you have not enough oxygen going to the tissues, what happens to the organs? They end up dying. So that is a very bad complication, and it is for dengue. So you start with the febrile illness, then you go to these non-specific symptoms. As you progress, you'll have dengue hemorrhagic fever, and then finally, dengue shock syndrome, where you die. Transmission, human-to-human transmission through the Aedes species. So Aedes, there are different types of species of mosquito. So for dengue, it's spread by Aedes mosquito. Once infected, a mosquito remains infected for life. So infected mosquitoes can also transmit the virus by trans-ovarian mode. So look at this. Here's the Aedes mosquito, vertical transmitter. So from one mosquito to another, it has got the virus from this is a primate, let's say a monkey. It gets it, then we've said once the virus has been infected in the mosquito, it is infected for life. So as you can see, this is the cycle. It gets it from another primate, then this mosquito gets it from this primate, like that. And then they can also be vertical transmission. Basically, what happens is when this mosquito lays its eggs and the eggs hatch, they already have the dengue virus. And then now this mosquito goes, it bites you. And when it bites you, you have the dengue virus here. Now, another mosquito will come bite you, then it goes to bite another human. this other human is bit by another mosquito, and that is how the cycle goes. Okay. For treatment, the major pathophysiological abnormal changes associated with dengue hemorrhagic fever or dengue shock syndrome is an acute increase in vascular permeability leading to loss of plasma, as I had explained the pathophysiology. Okay. Treatment is by early and effective replacement of plasma expander and electrolytes. So you're losing a lot of blood, so you have to replace this blood. Okay. Are we clear with dengue? Any question? So basically, treatment is symptomatology. So if you have a fever, you give them painkillers or antipyretics. If you have, I said you're losing blood. So if you're losing blood transfusions, and then you have to give fluids for these people. Yellow fever. So for yellow fever, it's an acute viral hemorrhagic disease, similar to dengue. Up to 50% of severely affected persons without treatment will die from yellow fever. An estimated 200,000 cases of yellow fever, causing 30,000 deaths worldwide each year. The virus is endemic in tropical areas of Africa and Latin America, with a combined population of over 900 million people. Same to this, you'll observe areas close to the equator or along the equator. So from Senegal to Angola here, and then from Brazil, Peru, Ecuador, Venezuela, okay? And then in Kenya, specific to us, we have yellow fever, but it is usually endemic in areas like Marsabit, Elgeyo Marakwet, Isiolo, okay? That's where you'll have endemic yellow fever virus. But there is a vaccine. The goodness is there's a vaccine present. In fact, before traveling, you'll see that you have to have your yellow fever vaccine. For those who have traveled, did you get your yellow fever vaccine? Mm-hmm. Yes, yes. So yeah, so you have to get the yellow fever vaccine. Okay, we go to clinical diagnosis. So the incubation period is 3 to 6 days, followed by infection that can occur in 1 or 2 phases. So for the phases, we have an acute phase and a toxic phase. Acute phase, non-specific signs, we said the febrile illness, we have fever, muscle pain, headache, shivers, loss of appetite, nausea, vomiting. Most patients improve and the symptoms disappear after 3 to 4 days. And then we have the toxic phase. So in between these phases, what usually happens is, as we've said here, the symptoms may disappear after 3 to 4 days. But now there is usually a remission period before we go to the toxic phase. Okay. So the remission period is when what happens is at around 2 days later, you now start getting this, you had fever, it now starts increasing. Okay. Now you'll see here at the toxic phase, 15% of patients enter a second. Within 24 hours, high fever returns accompanied by jaundice. So jaundice is the yellowing of the eyes, abdominal pain, vomiting, and hemorrhage. Hemorrhage is bleeding. Half of the patients die within 10 to 14 days. Okay. So when they say hemorrhage, what here we mean is you'll have bleeding. So you can bleed from your nose. You'll have nosebleeds. You can bleed from your mouth. You can bleed from your GI. So you'll have melena. You can bleed from your urine. We call it hematuria. Okay. And then you'll have jaundice. So these people will have yellow eyes or even yellow skin, and then abdominal pain, which is very severe, and very high fevers. Okay. Then we have transmission. We have syllabatic or jungle yellow fever, occurs in monkeys, mosquitoes, and humans. Intermediate yellow fever occurs in semi-humid parts of Africa. Semi-domestic mosquitoes infect both monkeys and humans. Then urban yellow fever, infected people introduce the virus into densely populated areas with a high number of non-immune people, and Aedes mosquito. Infected mosquitoes transmit the virus from person to person. So this is not really important. So the most important thing is you know that yellow fever is spread by Aedes mosquito. That's enough. Then we go to treatment. There's no cure for yellow fever. Symptomatic treatment aimed at reducing the symptoms for comfort of patients. So if you have abdominal pain, we check for the abdominal pain. If you have the fever, we give you fever-reducing medication. If you have nausea, vomiting, or the joint pain, we give you medication for those symptoms. Prevention of infection with yellow fever, vaccination. The yellow fever vaccine is safe and affordable. Not really. I mean, yes, it's affordable compared to what you can get if you don't vaccinate. Because I remember when I got mine, I paid around, was it 3,000 Kenyan shillings? So it's not quite affordable. But what I heard is the areas that it's endemic, like if you travel to Marsabit and Elgeyo Marakwet, where yellow fever is endemic, the vaccine is free. But if you're in Nairobi, the vaccine is around 3,000 Kenyan shillings. So it provides effective immunity against yellow fever within 1 week for 95% of those vaccinated. A single dose provides protection for 30 to 35 years or more, and probably for life. Yeah. So my vaccine was for life. I was told there's no need to get a booster. Long time ago, they used to do a vaccine where you get a booster after 10 years, but these days it offers lifelong immunity. People who should not be vaccinated include children aged less than 9 months, pregnant women, people with severe allergies to egg protein, people with severe immunodeficiency. Okay. Mosquito control, since we know it's spread by the Aedes mosquito, the risk of yellow fever transmission in urban areas can be reduced by eliminating potential mosquito breeding sites, use of mosquito nets, and remember these mosquito nets should be treated. Then we have things like insecticides, spraying, all those mosquito control measures that you know of. Oh. Then, so we are done with, where were we? We're done with Flaviviridae. So the main are yellow fever and dengue. Now we go to Bunyaviridae. So Bunyaviridae, we have Crimea Congo hemorrhagic fever, Rift Valley fever, and hantavirus. Rift Valley fever. So Rift Valley fever is a viral zoonosis that primarily affects animals, but also has the capacity to infect humans. Infection can cause severe disease in both animals and humans. So look at the animals. These are cattle. So Rift Valley fever affects all the cattle as well as humans. Clinical features, mild form of Rift Valley fever in humans. Incubation period is 2 to 6 days. Those infected either experience non-detectable symptoms or develop a mild form of the disease characterized by feverish symptoms. Remember, the febrile illness, muscle pain, joint pain, headache, nausea, vomiting, all those non-specific symptoms. But for severe form, we have ocular disease in 0.5 to 2% of patients, meningoencephalitis in less than 1% of patients, and then hemorrhagic fever in less than 1% of patients. Yes, so I'm done with arboviruses, unless you have a question.